My name is Dr. Brian Madison. I am an orthopedic surgeon and I work in South Sudan, as well as a faculty member in the College of Medicine, University of Juba. I deal mainly with undergraduate students who are working towards their bachelor's degree in medicine. So that's mainly my focus of work. The medical school at the University of Juba graduates around 60 medical students per year. And the affiliated university hospital is not very big. It has a bed capacity of around 200. For orthopedics and trauma, we have a bed capacity of 20 beds. What I would like McMaster residents and faculty to know about my surgical practice in South Sudan is that it's fairly new. South Sudan just gained independence in 2011. And as we speak, the whole country has a population of 10 million, but only has 6 orthopedic surgeons. And all these orthopedic surgeons are focused in the capital city. So that means there are a lot of people out there without access to orthopedic care. And yet it's one of the biggest problems because trauma is a huge problem back home. Back in South Sudan, people use motorbikes as a means of transport. So there are safety concerns and there are a lot of accidents out there. As well, gunshot injuries are quite common. Being a country which is just out of conflict, guns are everywhere, so we get a lot of gunshot wounds. I found out about St. Joseph IOP program through Dr. Michelle Gert, who was in Tanzania while I was doing my residency. She came there as a volunteer. So that was when I met her, and we discussed about training opportunities, and she told me about St. Joseph and how I can get a fellowship in Canada through the IOP. It took almost a year for me to finalize everything and get back here. You know, getting in touch with people who have a lot of experience with trauma will certainly give me the opportunity to get more skills. This fellowship is more hands-on. As I've said, the process was lengthy, so I had to be registered with the CPSO so that I'm able to scrub in and get more actively involved in patient care, in the clinic, intraoperatively with procedures and so forth. So this fellowship program is, especially in the surgical field, it's very important that you get your hands in. So this is the main difference between the fellowship and the observership that I had. The impression that I had from my time during this 1 month of my fellowship, in terms of patients are quite different here. Back home, patients have 100% faith in the doctor, so whatever you say goes. Here it's quite different because they're more, they go on and Google everything and make sure that when they come, they have a lot of information and you have to clarify more. You have to spend more time with the patient, talk with them and so forth. That's mainly the big difference that I had. But talking about my fellow residents and the fellows and residents, they've been very, very welcoming. The environment in general is quite welcoming. And also the staff, the nursing staff within the hospital, they're very nice. So overall, I had a good experience. If there is anything in Hamilton that really surprised me, is the diversity that I've seen here. I never thought that I will encounter people from all corners of the world in Hamilton. And as a matter of fact, accidentally, I met twice or 3 times people from South Sudan just walking in the streets. So that's the biggest surprise for me here in Hamilton. For the weather, I'm not very much surprised. I knew it was going to be cold, but maybe I was surprised that I could adapt to it thus far. It's almost 1 month and it's cold, but I'm adapting to it fairly.